This is a discussion of the features that help distinguish normal moles from melanoma from direct observation. And the mnemonic is A, B, C, D, E to help remember the features. None of the features by itself is diagnostic, but they're all taken together to make a judgment about whether a mole looks unusual or atypical. So the first feature is A for asymmetry. And asymmetry just means that normal moles are round or oval, and if you divide them down the middle, you can fold one side on the other and it fits perfectly. An asymmetrical mole you wouldn't be able to do that, where if you divided it down the middle and tried to fold it over, it wouldn't fit exactly. So asymmetry, it's a sign that the cells inside of the mole are growing at different rates, and that is producing the asymmetry. And that's tied somewhat to border irregularity. So border irregularity means it looks like the map of a country. Moles typically are round or oval, but when they take on an unusual shape, it's because the tanning cells that make up the mole are proliferating at a different rate, and that produces an irregular border. So the map of a country or a geometric shape is typically the expression. The third thing is different colors in the same mole. And so those colors are typically red, and that's an area where there's an increase in blood flow. There's black, whereas there's an increase in pigmentation. It could be areas that are white where there's no pigmentation at all. There could be areas that are blue, and that's where the pigmentation is deep in the skin. And then there can be pigmentation of brown. So it's really the mixture of different colors that really what you're looking for. If a mole is all one color, that means all the tanning cells are producing the same amount of pigment at the same rate and gives a uniform color. When there's different colors in the same mole, the red color would indicate that there's inflammation and dilated blood vessels. The black color would indicate an overproduction of pigment. A white area is where there's no production of pigment, and that's all a sign of disordered growth. The fourth thing is a size greater than 6 millimeters. So 6 millimeters is the size of an end of a eraser on a pencil, and most moles are smaller than that, and they shouldn't get larger than 6 millimeters in diameter. There are exceptions to that, and primarily moles that are present at birth can be bigger than 6 millimeters without that being a criteria. But for most moles that come up later in life, criteria of 6 millimeters is important. Moles should be smaller than that. And then the last criteria is evolution, which basically means a mole's increasing in size over time. And most moles that come up in adulthood or early adolescence, and they shouldn't continue to grow. So if a mole's been sitting without change for as long as you can remember, and then all of a sudden starts to grow and increase in diameter, that would be another criteria. So no one criteria by itself is diagnostic, but taken together, those are the things that help diagnose melanomas early. And diagnosing melanomas early is critically important, and that'll be covered in a subsequent video about how melanomas evolve. So I hope this is helpful, and you learn something that you can remember will help you evaluate a mole. Most moles in melanomas are discovered by the patient rather than by a provider. So patients will come in noticing a mole has changed or developed an irregular color or is getting bigger about 70% of the time. So self-examinations are really helpful in that regard. And also you can use photographs on your phone. If you have moles or that you want to keep track of, you can take pictures of them, and then you'll have them for reference. You can even put a little ruler down beside them to see if they're increasing in size or changing at all. I hope this is helpful, and take care.